Dear colleagues, the case I will present to you today concerns a fetus affected by multiple and bilateral choroid plexus cysts, an abdominal cyst, and hypokinesia of the lower limbs, findings observed in a patient who came to our clinic at 16 weeks and 6 days, having previously undergone first trimester screening with ultrasound and NIFT, both of which were normal. Choroid plexus cysts are cystic formations containing cerebrospinal fluid that typically appear as echogenic areas in one or both choroid plexuses, usually within the lateral ventricles. They have a prevalence of 1 in 50 fetuses at the 20th week of gestation, but in more than 90% of cases they resolve by the 26th week. Their detection requires a detailed ultrasound examination to rule out the presence of other anomalies, as they are associated with an increased risk, particularly of trisomy 18. In the specific case at hand, as I previously mentioned, multiple and bilateral choroid plexus cysts were clearly found in both the left and right lateral ventricles. Specifically, the largest one observed on the right side measures 9 full millimeters, and on the left side, it measures 13.6 millimeters. A complete neurosonographic study is then performed, which does not show any other anomalies. The posterior ventricles have a normal diameter of 5.8 on the right and 6.1 on the left. The transverse cerebellar diameter is within normal limits. The cisterna magna shows normal dimensions. There are no tumors in the posterior cranial fossa. The thalami are normal and the cerebral phalanx is normal. Let us now move on to the study of the abdominal cyst. When a fetal abdominal cyst is detected, it is necessary to study its anatomical location, its relationships with other organs, particularly the stomach, liver, bladder, and kidneys, and the study of its ultrasound characteristics will allow us to determine its nature. Therefore, it is particularly necessary to thoroughly study the size, the number, the presence of internal tissues, the vascularization, and the echogenicity. As you can clearly see in these illustrative clips, this is a single well-defined abdominal cyst measuring precisely 9 by 7 millimeters with regular smooth walls and anechoic content, and it is negative on color Doppler. We then study its relationship with the other abdominal organs, thus ruling out that it is a cyst of the genitourinary system. Furthermore, the fetus is male, which rules out the hypothesis of an ovarian cyst, which is very common in the prenatal period, although generally at a more advanced stage. There is no communication with the stomach or with the gallbladder. In this slide, I am showing you a summary diagram of the different etiologies of fetal abdominal cysts along with their respective ultrasound characteristics. Based on the characteristics of the cyst in this case, the most likely hypothesis seems to be that of an abdominal lymphangioma. As mentioned at the beginning of the video, during the ultrasound examination, hypokinesia of the lower limbs was also observed. The ultrasound examination lasted for more than 30 minutes to allow for an adequate assessment of fetal movements. During the entire duration of the exam, no adequate movements were observed, neither spontaneously nor after mechanical stimulation, as can be seen in the video. More precisely, hypokinesia is defined as the reduction or absence of spontaneous fetal movements observed by ultrasound. This condition can be either transient or more persistently present, and it is certainly more significant if it is persistent and the earlier it actually appears during the course of the pregnancy. It can be due to various causes. In particular, it may underlie neuromuscular causes of genetic origin, cerebral or spinal anomalies, or secondary causes such as severe oligohydramnios or early rupture of the amniotic membranes. The finding of hypokinesia is a warning sign that always requires a thorough and repeated evaluation. Returning to our case, a thorough study of the fetal anatomy was conducted, and although we are not yet exactly in the second trimester screening period, because I remind you that the patient came to our clinic at 16 weeks and 6 days, we can state that no further malformations were found, and the biometric parameters are also within the normal range for the gestational age. Finally, regarding the comprehensive management of this particular case, a targeted ultrasound reevaluation is absolutely necessary to confirm persistent fetal hypokinesia in subsequent checkups as well. with ultrasound follow-up occurring every 2 to 3 weeks. The patient is also strongly advised to undergo prenatal genetic counseling with amniocentesis for a detailed karyotype and array CGH analysis, specifically utilizing a comprehensive panel for hypokinesia. Thank you all for your attention.